Yes, mate. Oh, that deserves a picture.
He's known as the Supervet.
You all right, mister?
That's good. It's going to make you stand again.
Very gently hold that.
His extraordinary vet practice and cutting-edge procedures
Hi, mate. 25 years ago, I would have said it was impossible.
have saved the lives of thousands of the nation's pets.
Oh, that's so good.
Well done. Good girl. Good girl.
Professor Noel Fitzpatrick and his team are constantly developing new treatments where other options have run out.
All right, all hands on deck. Let's get into theatre now. Nothing about this fracture is textbook. This is totally unpredictable.
And when hope fades,
I'm not telling you that he has to be put to sleep, but I am telling you that we do have some big decisions to... I'm sorry.
Noel continues
All right, let's go.
to search for medical solutions,
I'm not God. I am just a bloke trying to do his best.
Come on then, baby.
offering a chance
I've got my dog back with bells and whistles on.
against all the odds.
It's okay, Baba. It's okay.
Right.
I just think it's amazing. Amazing.
Yes.
Good afternoon. Fitzpatrick Referrals, Orthopaedics and Neurology. Natalie speaking. Can I help?
At Fitzpatrick Referrals in Surrey, organisation is key to keeping things running smoothly.
Freddie is over in first time of surgery. Puppy is in prep now. This is the order we need to do the rest of them in. Yeah, we've got a lot of stuff to go on out, but it's fine. It's all fine.
The staff may be busy, but the patients, however small, always come first.
Oh, it's got a proper new puppy smell.
Hi,
Come on then. Good girl.
This morning, a one-year-old bull terrier has arrived for treatment.
Hey. Apple is extremely friendly. Are you chatting? A lot of people get quite scared of bull terriers because they think they can be quite aggressive, but Apple has never been. I mean, she's more likely to lick you to death than bite you. Apple is a good girl. 7 months ago, after long walks, Apple was limping and couldn't put weight on her leg. So we took her to our local vet and she was referred to Fitzpatrick's.
Ruth and her 2 children live in London.
Who's that? Hello, who's that?
They got Apple when she was 8 weeks old.
I've been asking to have a dog since I was like 4, and I finally got one. She's the best you could, ever have.
She's just really energetic and she's fun to be around. Is that the spot that you like?
She's also been lovable trouble from day one.
Apple has eaten about 5 socks and she's now known at our local vet as Apple the sock eater. Oh, not my finger, not my finger. So Apple came into our life at a time that our family had had quite a lot of difficulty, really. Myself and my husband recently separated. Also, I had recently lost my mum through pancreatic cancer, and Apple brought a lot of happiness into the family. Yeah, oh, thank you for your kisses.
When they noticed Apple's limp, they immediately sought help.
I was really sad for Apple because she loves her walks and I wanted her to be able to enjoy running around like a crazy thing. But I was concerned that the injury would get worse. I realized that ultimately I don't want this very gorgeous creature to be in pain. Apple, enough cuddling. This way, good girl.
Apple has been referred to Fitzpatrick's with a developmental disease of her ankle. Noel is hoping a specially designed implant may help reduce her pain.
Hey, how you doing?
Good
Nice to see you.
morning.
I've got lots of things to tell you because I've just been reviewing all these images because Sarah asked me to have a look at this. Hello, mate. You're a beauty, aren't you? All right, so this is the left ankle and that's the talus. which is the main articulating bone, the main bone that actually moves within the joint at the bottom of the tibia.
Right.
And on the surface, there's 2 ridges. 1, 2. And the inside one has a big hole in it.
Has it kind of chipped away?
That's right. So this surface here, that should be covered in cartilage like so.
Yeah.
In reality, this doesn't develop properly into bone, and then it flakes off.
Okay.
Now that is what I'm going to try and replace, because there is no cartilage left on that ridge, and the raw bone underneath is rubbing away on that surface.
So that's where the implant's going to go.
That's right.
So yeah, so it'll behave like cartilage.
Yes. Can I just examine her? You just move her chair back there. I'll just have... All right, Booper, let's have a look here. Come here. If I do this, that'll probably hurt, which it does.
Ooh, good girl.
So that's me forcing the ankle into extension, which is the most painful thing.
Yeah.
Now, you have another problem as well. Do you see the irregularity in that? I'm talking about that and that swelling, which you can clearly feel over the ankle. That bump is called the medial malleolus. There's ligaments attached to that hold the ankle together. And at the origin of those ligaments, it's not normal. It's jagged.
Yeah.
And in and of itself, that can cause pain.
Oh, baby.
Now, I can't treat that because you can't replace the medial malleolus.
Right.
So, my worry is that even if all of this works out great and we replace the ridge and everything is fine for a period of time, my worry is that osteoarthritis will continue in this joint.
Yeah.
What I'm saying to you is, I don't know hand on heart if this is going to be curative.
Yeah. No, I hear you. Okay.
So I can...
But would you still suggest you go forward with this procedure?
So we have at the moment 3 choices: treat her medically, just give her pills, or inject the joint, which is temporary, or do the surgery, or fuse the ankle solid.
Yeah.
And we don't have to do the surgery. It's not life-threatening. It's just debilitating and painful.
That's the thing. I would like her to have the best possible quality of life.
Most of the time, in our subjective opinion, most of the pain is coming from the defect within the joint. Therefore, if we fix that, we should be able to significantly improve quality of life.
Yeah.
And by the way, if you need some time to think, no problem. You can have it.
No, that's fine.
Alrighty.
Apple! Good girl.
You can go ahead, Catherine. Thank you.
Thanks, Catherine.
Bye, Apple. Look after yourself.
Ruth decides to go ahead with the operation.
So much. God bless. Cheers.
Come on, Apple.
I did feel sad, and I think it's going to be very weird going home and having no Apple there, and the children coming home from school and no Apple there. And I think next few days will feel very long.
It's late afternoon, and an emergency has just arrived at the practice. A 2-year-old Siamese cat called Siam has been run over by a van. He has a broken leg, shattered pelvis, and a suspected spinal injury.
Poor pussycat, he's sick.
Siam is Heather's cat, and at home, the pair have a very special relationship.
Heather has very complex disabilities and severe learning difficulties and dementia. It's a degenerative condition. It's so rare that there's nobody else in this country that's got it. Animals with Heather is just all her life. They sort of know she's different and they adapt to her. They're very gentle with her.
You purring?
Siam sort of seemed to just get up on her chest and purr and nuzzle and knock her about with his paws.
He's just lovely, isn't he? He's going to give you a kiss, I think.
And for me to see that is a joyous thing.
Heather and Vicky know the practice well. 8 years ago, Noel fitted their basset hound, Bumblebee, with a bionic leg.
Heather met Noel right at the very early stages of the treatment with Bumblebee, and he just explains things very simply so that she understands, but he won't do anything to any animal that I own without Heather saying, yes, it's all right, and understanding what it needs to be done.
Hello, my lovely friends. How are you?
Hi.
Hello. Hi. How are you?
He got
Long
run over
time
by
no see.
a van. He got run over. I poor you pussycat.
I
is
heard
sick.
about this. Come on, let's go straight in. Oh, my Lord. Is he your new friend, Heather?
Yeah, Siam.
He's beautiful, Heather. Please sit
Yeah.
down. So tell me exactly what happened, Bo.
A neighbour sort of knocked on my door and said, your cat's in the corner of your front garden.
Okay.
Rushed him straight to the vet. You know, they've given him some fluids, some painkillers. The x-ray aren't brilliant from what he's saying, but...
No.
Siam's pelvis is broken into several pieces, and there may be nerve damage too.
All right, let's have a look here. Hello, mate.
He's so
Hi,
friendly.
buddy. He's a sweetie, isn't he? Hello, matey. Okay. All right, big fella. I'm just checking, Heather, that he can still feel his legs and move them. That's the important thing.
Yeah.
Okay, so he can still feel
Yeah.
them. That's good. Now, he's broken his hip cup on this
Yeah.
side.
Yeah.
And he's separated this side of his pelvis from his spine, and he's also fractured down the middle. So I'm going to talk to you about what we're going to have to do, okay?
Yeah.
No, you're going to show you what's wrong with
Now
him.
listen, this is the pelvis here, and this is smashed. But hopefully I'll be able to put all that back together again.
She just said to me out there, she said,
Yeah.
he'll be in safe hands, Mum, don't worry.
Yeah, well, I know he's pretty broken. Hopefully we can sort him out for you, Heather.
I don't want him in pain.
No, absolutely not. I'll give him to Jason. So, do you want to give him a big kiss goodbye now, Heather?
Yeah.
There you
Nice,
go.
Siam.
There you go. Good boy. There you go. Thank you. Right, Heather, you're going to give me a big hug then.
Yeah.
You all set?
Yeah.
Be careful now.
Yeah.
Look after yourself
Yeah.
and lots of love, okay?
Take care, my love. Thank
No
you.
worries.
Don't
No
work
worries.
too hard.
Yeah, look after yourself.
You're okay, Siam.
Before he can perform surgery, Noel wants more detailed images of Siam's injuries.
Siam.
If the damage is too severe, Siam may lose the leg. The images are back for Siam, the Siamese cat who was run over by a van.
That's really bad. That hip socket's fractured in several pieces like a pane of glass. So the femoral head is punched through into the pelvic canal. The inside wall is fractured. That's wafer thin. I don't know how many pieces are in there, but I know that the inside wall is exploded inwards. There's more pieces here and a big fracture there. There's a little piece, there's a little piece, there's a little piece. They're all shattered. It's going to be very, very difficult to reconstruct that.
The bone injuries are severe, and the splintered fragments may have damaged Siam's sciatic nerve.
All right, let's do it. Okay, so let's see what we got.
Noel plans to realign and stabilize the front and back part of Siam's fractured pelvis with a plate and screws. He'll use wire to try and bring together some larger fragments of the smashed left hip socket whilst protecting the sciatic nerve. Then he'll reattach Siam's right ilium to his sacrum using screws.
So the first thing I tend to do when I'm repairing fractures like this is get down onto the bone and identify what the major blood vessels and nerves at risk are. And in this case, the major nerve at risk runs inside the pelvis and down the back of the leg. It's called the sciatic nerve. The very sharp edges of some of these fracture fragments are sticking into the sciatic nerve. And that's quite a big issue, because if we lose that nerve, we lose the use of the leg. Give me a small jig pin set.
Noel positions a plate, which will act as a base.
Don't move your fingers.
To rebuild the fractured hip socket around.
Get me the loop wire. Because the bone is fractured in tiny fragments and there's a massive slab off the inside of the socket, I can't get a plate on the inside of the socket. So I'm going to try and use this fishing hook to pick up the bone to pull it into place. All that suction tip right there. So the top of the pelvis should heal fine, but the inner part of the socket will not be reconstructable. The other problem is going to be whether that nerve recovers, because it's been pretty damaged by those fractures exploding under it.
Noel uses 2 screws to reattach the pelvis onto the sacrum the other side.
So the left hind leg is likely to be a problem for a very long time. We'll see. That's the best I can do, and unfortunately the accident has really smashed up the biology here. And either the nerve will recover or it won't. If it doesn't recover, then there's no point in trying to save the leg. All right. Okay, good. Let's go to X-ray, please. Thank you.
Noel must break the news to the family.
Hello.
Oh, hi, Vicky. It's Noel.
Hi, Noel. How is he?
He's fine. It was just a very, very difficult surgery.
Oh, no.
Basically, the left hip socket was shattered in more than a dozen pieces.
Oh, Lordy.
We don't know if he's going to regain function of that leg or not at this point. Unfortunately, the jury's still out.
Right. So much worse than we thought.
Yeah, unfortunately, yeah. Yeah, the worst case scenario will be we would lose that leg.
Oh, that's going to break her heart, isn't she, again? Bless her.
Yeah.
How long do you think before we'll know if he can move the leg?
A week? Well, I'm going to continue to do everything I can.
I know you will, darling.
I'll give you a call tomorrow afternoon.
Bye now, darling.
Take care.
Bye.
My friend has got a big boxer, and I'm convinced that he speaks like this. Give me a cuddle.
Yeah. I would love it, you know, if they could talk.
I'm a Labrador, and I like to run and eat things and wag my tail.
Noel's patient this morning has little problem communicating.
On your belly rubbed.
Jenna has brought in her 4-year-old collie cross, Rosco, with chronic hip pain. Jenna works in an animal shelter in Newcastle. Noel visited the centre in 2017 as part of his Animal Rescue Live series. The team look after and rehome over 1,000 abandoned animals a year, including one very special dog.
Rosco was born at the shelter and all his brothers and sisters were rehomed round about the same couple of days. Rosco was left over with no home ready, and I was off for 3 days and I thought, oh, he's never been alone by himself. I tell you what, I'll take him home for the weekend.
Good lad. Nice.
And he ended up staying forever.
Rosco has such a gentle nature, he helps out at the centre and beyond.
There you go.
Rosco has a huge impact on people's lives. He goes to schools to teach children how to behave around dogs. He goes to care homes where the old people interact with him, and it really brings something to their lives.
But recently, Jenna noticed that Rosco was suffering from pain in his hip. An X-ray picture at the local vet's revealed he has hip dysplasia.
It came on quite quickly. He'd literally come back from a walk one day and his right side seemed really stiff. It's massively affected Rosco at work. We've had to retire him for now.
Jenna contacted old friend Noel immediately.
When Rosco was diagnosed, we couldn't think of anyone better. We knew that if Noel couldn't do anything, then there was nothing we would be able to do.
Rosco, please.
How are you?
How are things up in Newcastle?
Busy.
Good. Lovely to see you.
You too.
We had a great time when we were up there. How are all the rescue animals?
They're good.
Are you looking after hundreds at the moment?
We are, but rehoming's still fantastic.
Good. But please take a seat. Now, talk to me about when any deterioration happened.
It was really quick. He started bunny hopping on his back end. So took him to the vets, and obviously they found hip dysplasia in his right hip.
He's really good at hiding, you know, if there's anything wrong. I know him here. He's really good at hiding. I think he just doesn't give away much. And lately he just doesn't seem happy and he seems in a lot of pain.
Yes, mate. What was that? What was that? You're having difficulty doing what? Oh, I see. Okay. Right. So we're going to do a physical examination now. Can we stand him up, please?
Yeah.
All right, big fella. You just support him here for me, please. Yeah. Just one of you on each side, please. That's it. Just hold tight. He certainly doesn't like manipulation of his hip. He's also sore on the left hip, but not as much as on the right. And what I'm going to do next may hurt. I apologize in advance. Sorry, mate. Sorry, buddy. All right, big fella. It's okay. It's all right. Thanks, mister. Well done. I just wonder whether he has both lower back pain and hip pain, or whether the back is flaring up because he's taken weight forward. Sorry. I know. There you go. Yeah. It's always difficult because he's your pal, and obviously you don't like to see him in pain. He's also got beautiful eyes. What is clear from the X-ray pictures is that you do indeed have some hip osteoarthritis, particularly on the right side, and that is indeed due to hip dysplasia, which is a loose hip. So the hip, as it develops, is normally held in place by tissue. And when the bone and the muscle and the soft tissue doesn't grow at the same rate, this gets loose. So gradually, the head rubs abnormally on the top of the socket, and if it's irritated, it produces new bone, like inflammation.
Yeah.
So I would suggest that we crack on, anesthetize him. I would recommend we do a scan of the lower back, and then I have the information.
Right.
Are you okay with that plan?
Yeah.
Okay. See you shortly.
Thanks.
All right. Good. All right, come on, Bob. There we go.
Rosco will have an MRI scan of his lower back to see if there is a problem there, and X-ray pictures of his hips.
Hi guys, come on in. There is not a primary disc problem.
That's good.
Okay, but there is a primary problem with both hips. So the next thing then is how to treat it.
Yep.
So there's a good rationale to put a new hip in on the right-hand side, which is the worst hip,
Yep.
and suck it and see for the left one. Many dogs that have one done feel a lot better.
Yeah.
Risk of complications. With a hip replacement, you could have a failure of bonding of the bone to the metal. You could have a problem whereby you fracture or fissure a bone. You could get sciatic neuropraxia, which is where the nerve is temporarily stretched. Most of the time that comes back pretty quickly. Infection's always a possibility with any joint. Anything can go wrong. It could dislocate after the operation. One would hope that we tighten things up enough that it doesn't. Okay?
Thank you
No worries.
so
My
much.
pleasure. My pleasure. Thanks for
Thank
being
you.
beautiful human beings and looking after all the animals.
Thank you so much.
No, pleasure.
Bye-bye.
See you later. Bye. Okay, proceed.
The surgery will hopefully make a big difference to Roscoe's life. If it goes well, he'll be able to return to work as a care dog.
I'm sure there'll be a few tears and, you know, worry and sleepless nights, but he's in the best place and that's all you can ask for, really.
You feel okay, baby? Okay.
Apple, the young bull terrier, is having her ankle surgery today.
Scan me, please. Let me know. And I'll
Noel hopes it will relieve the pain she's been in for most of her short life.
Morning. You ready, girls?
Noel is going to replace the defect in the bone and cartilage of her ankle joint with a 3D-printed, custom-made implant.
Suction on.
To get access to the joint, he first needs to cut and flip open a piece of Apple's tibia.
Okay, we can see here where we've got a defect in the talar ridge, which is the top of the talus bone right there. There's a hole right here. I'm going to take that piece of dead bone and cartilage out. I'm going to drill out this hole and put a new cap on it. Stay where you are. Hold it there.
Noel drills out a recess of the exact size and shape to fit the underside of the implant, and using a custom guide, creates a hole for the peg.
This is the implant. It's got a mesh backing onto which hopefully the bone will grow. This peg should stop it moving, and this is the smooth surface for the joint. Hold on, stay there. Francesco, hold the foot. We can see here the new ridge moving in the ankle joint. That was technically challenging because it's just a very small bone. We're going to put this side of the bone back on again like so.
Noel reattaches the part of the tibia he flipped open earlier and fixes it with a plate, screws and wire.
And this wire will press down the bone where we've just cut it open so it shouldn't re-break. So now we're putting in the permanent screws. Can I have a 3 metric PDS with an NF needle, please? Okay, so we've got the plate in now. Everything's secure. And we're just going to stitch up. The best we can hope for is decreasing the pain inside her joint with that new surface. And then we'll see how she goes. We'll see what the ligament feels and looks like. Okie dokie, let's go to CT. Thank you.
It will be another 2 months before Apple's bone grows solidly into the implant. Only then will Noel know if the operation has been a success. Fitzpatrick Referrals has treated thousands of animals over the years. And when they return, the staff often form very close relationships.
You definitely form a bond with your patient. You nurse this patient through their surgery, through their recovery, seeing rechecks after rechecks.
To be honest, most of the time we're more excited to see them than they are to see us. They definitely recognise you. They know that you've been looking after them.
Sometimes you see patients over a course of years. We hope they form that bond because we try our best for their family members. The furry ones only, though.
One friend of the practice is in the pool today. Siam had surgery 12 days ago, and Noel is hoping hydrotherapy may help his leg recover.
All right, you got your little jacket on, mate. Good boy. Off you go.
Siam's pelvis and sciatic nerve were badly damaged when he was hit by a van. So far, he's not been able to use his left leg properly.
So it's really important that he starts to get movement in both his quadriceps and his hamstrings. Good boy, Siam. So the objective is to get that muscle built back up, get that nerve working better. But we can't be sure that that's going to happen yet. Well done, mate. Good boy, you did very well. Well done.
Four-year-old rescue dog, Rosco, is having his total hip replacement today. It's a big operation that requires 2 separate implants.
Hopefully this hip replacement will be pretty straightforward. If all goes according to plan, we should be in and out within an hour.
Noel is operating on the worst affected hip, in the hope that surgery on the other side won't be necessary.
Okay. Jack the table up, please. Everybody ready? All right, let's do it. Hold it down. So we're just chopping off the head of the femur now. What we can see in here is that the cartilage is severely eroded. The 24BFX femur.
Each patient requires a specific sized implant to fit their particular bones.
We can see the cup has a honeycomb surface here into which the bone will grow and a plastic liner to replace the cartilage. So we're just going to pop the cup in now.
The cup is hammered into the bowl-shaped space that Noel has drilled into Roscoe's pelvis.
So the cup is in now. We're just going to put a stem in now. We've assessed which size stem we're going to use. This is a dummy stem. We're going to put a trial head on. The stem size is correct, but the neck length is too long. So we're going to have to go down a stem size. Just going to double check that this will fit in.
Once the stem is secured into the femur bone with cement,
Yeah, that'll fit in, no problem.
Noel can put the head onto the neck of the stem, which will fit into the new cup in the pelvis.
We've got to make sure that the angle at which the neck is set relative to the cup is correct. So it's just popping the stem in now. The neck must be facing slightly forwards and the cup facing slightly backwards. Then we just pop a head on there, hammer it on, pop it in, and we're done. So we just pop the new hip in now. Just going to check it's tight. Yeah, that's fine. So we just stitch up the muscle now and then we're all set. So an hour is really the difference between having a painful hip and not having a painful hip. Okay, good, let's go to X-ray, please, thank you.
Rosco will spend the next 3 days recovering in the wards. In the cattery, it's now been 4 weeks since Siam's emergency surgery to fix his shattered pelvis. Despite physio and hydrotherapy, Noel is concerned that his leg function is still not recovering.
So a month ago, Siam came in with really bad fracture of the left acetabulum. The medial wall was imploded. That was in a bazillion pieces. I couldn't reconstruct it. What I don't know is whether the sciatic nerve is gonna recover adequately.
Okay.
Or if we now should go for a full limb amputation. So if we could do a nerve conduction velocity on the sciatic from top to bottom, sure, and see what you think.
Neurosurgeon Jeremy Rose is going to conduct a series of electrical tests on Siam's leg muscles.
So what we're seeing here on the screen is that there's lots and lots of spontaneous activity, which suggests that there's either damage to the muscles on the nerve, so these little bad boys that are jumping all over the place. And we'll just go around and we'll test every muscle group. We've now put the needle into the quadriceps muscle, the front of the leg here, and that's electrically silent, so there's no spontaneous activity there. And that would fit very well with what we suspected from looking at the cat before, which was that just one of the nerves, the sciatic nerve, was affected.
What's it like without him?
It's a bit sad.
Yeah, it's very sad without him at home.
Jeremy's tests have revealed a problem.
Basically checked, and all the muscle groups that are innervated by the sciatic nerve have got indication of lack of nerve function or muscle damage. And then when I test the nerve itself, the nerve function's exceptionally poor. So in essence, that sciatic nerve is really badly damaged, and I think my recommendation would be that you amputate the limb, I'm afraid.
Yeah, I fear that would be the case. Man, that's really disappointing, isn't it, to talk to them about?
Oh, I'm sorry.
So, Heather, the nerve that goes down the back here, not working well.
No, not working well.
But working not well to the point of being very poor. So I'll show you, because he's right here.
Oh, Heather, he's here.
Come on in, Siam. There we go. There we go. Hello, everybody.
Hello, my darling.
How you doing?
Who's this here?
Siam.
Now, we can take this off for a minute.
Darling.
There you go.
Yes, Siam.
Hello, darling.
He's very friendly.
Yeah.
He loves to crawl up on my chest when I go in the...
Does he bite your feet though?
Yeah, no,
He bites my feet.
we don't let him bite my feet. So when he's moving along, Heather, as you can see, when he walks along, he drags the leg still. So initially, we had to fix the pelvis anyway because he was in quite a lot of pain.
Yeah.
And if we didn't fix the pelvis, he wouldn't be able to crouch and poo. But it's not likely that that nerve is going to come back enough.
Yeah.
I think it's probably best for him if we take the leg off.
Yeah.
As long as you're able to cope with that, I think he can.
It was shattered, wasn't it, before it was shattered?
It was all shattered and badly hurt, wasn't
it?
In Siam's case, when the nerve was not recovering for the leg, we felt it was in his best interest to have the leg amputated, because it's all about providing pain-free, functional quality of life, and most cats will manage absolutely fine on 3 legs. I'm sorry, I'm going to have to take his leg off, Heather.
Yeah.
I'm sorry. Do you want to say bye-bye for now, Heather?
Yeah.
Bye-bye for now, bye-bye for now. I'm going to take his collar,
Yeah, so he
and I'll
doesn't
be
eat,
right back.
Yeah.
Okay.
Make sure he doesn't disappear.
Got him. Got him.
Look at him looking.
Okay, big guy.
Yeah, it's good, isn't that?
Yeah.
What do you think?
Yeah.
So what do you think?
Yeah, it's had it. It's no good. He's had it.
Right, so he's gone back to his bed now, Heather.
Yeah.
And the next time you see him, he will only have 3 legs.
Yeah.
Is that going to be okay?
Yeah.
Are you sure?
Yeah.
You sure?
Yeah.
We just want him home. Hoping for a better outcome, but he's walking, which he certainly couldn't walk when I brought him here. So we'll just have a cat with 3 legs. Do you understand what's going to happen?
3 legs.
3 legs, but that's okay too.
Yeah.
Yeah, we're okay. We're okay.
Apple, what are you doing?
It's been 2 weeks now since Apple, the young bull terrier, had a custom-made implant fitted into her
A
ankle.
little too happy. Oh, no, good girl.
She's been staying at the practice as she's needed regular bandage changes.
All right, Booper. Let's have a look here. All seems fine. All right, good girl.
It's time for her to go home.
Hello, I'm here to fetch Apple. Yeah, it's been really hard, actually. The children particularly, well, we've all missed her loads. But there's been conversations about her absolutely every day. Yeah, so we're really looking forward to having her home.
Hello. How are you today? Nice to see you.
Good.
You okay?
Good.
Everything's going fine.
Good.
There you go.
Thank you.
So this is what we have now. We have a new ridge and we have a plate and wire. So that's what it looks like in 3D. So you've got...
So cool.
Yeah. So this is the base CT scan data. That's the new ridge over the hole.
Yeah.
So that is your new joint surface. And that is articulating against the bottom part of the tibia. And the hope is that that will grow into the underneath of that in the next 4 weeks. And that becomes then a solid part of the body. However, in those 4 weeks, it still potentially could rock. Therefore, no running, no jumping, no slipping, no sliding. Lead only on the harness. Never off the lead.
Yeah.
Under any circumstance.
Got it.
I'll get her in for you, and we'll just show you what to do next. Now, where is my little friend?
I don't know if you know the breed. They're
I do,
crazy.
yeah.
They run around like
Just a
loons.
little bit mental. Come on in, sweetie pie. Look who's here.
Hello.
Now,
Hello, darling. Hello.
happy to see you. Happy to see you.
Hello. I didn't leave you forever, baby. Oh, look how excited you are. Yes.
Now, come on, sweetheart. Here we go. Let's go in the yard. Now, just Nadine will show you how to walk up and down there.
Darling.
If you just go this way, go this way, go this way. There we go. Stay away from the. Stay this way. We don't want any shenanigans there. So as you can see, she's already wanting to use it pretty firmly, but you must hold her back with this. I can't be risking trauma. Walk away from the dogs, Nadine. Basically, keep her from doing mischief.
Right.
And you've got your cage ready at home?
Yes.
So please, I cannot overemphasize, do not let her run.
No, got it.
You got 4 weeks, and if you get through those 4 weeks and everything heals, you're done. And you got to focus on that.
Okay.
Right, look after yourself, behave yourself, take care, behave yourself. Okay? I'll see you soon. God bless. Cheers.
Oh, Apple, Bapple, right. Oh, it's great. She's as nutty as ever. I do wonder whether they think you've abandoned them. I'm not going to let you go. Don't worry. So she's not to run or jump. How are we going to do that? Just watch her like a hawk, I guess.
With such an energetic puppy, the next 4 weeks of confinement are going to be tough on everyone.
Mind your cone.
It's been 8 days since 2-year-old Siamese cat, Siam, had his hind leg amputated. Today, he's well enough to go home.
Well, Siam is doing fine.
Yeah.
But he's on 3 legs, you know that, don't you? Yeah. Everything's healed back onto his spine, and he's not in pain, and he's happy.
Oh, Heather, what do you say?
Oh, look, it's my pleasure, my pleasure, my pleasure, my pleasure. Oh, here we go. Did you bring a pink basket? Yeah.
But it opens at the top, and I just thought...
Now, who's this?
Get him in and out.
Now, mister. Now, mister. Hi, buddy.
Hi, buddy.
How you doing?
There he goes. Look, Heather, here he's off.
Yeah.
Oh, that's much better.
Using his tail as a counterbalance, Siam should be able to move around with relative ease.
Siam, darling. Who's here, Heather?
Now, there we go.
Hello, darling.
Good. So he's looking in good spirits, isn't he? I think he's using his tail as an extra leg.
Yeah.
So you're definitely using it as a rudder.
Baby boy.
And his will to want to do it now is excellent. So you can take him home now. We'll pop him back in his little basket.
What do you think?
There
You've got
we
a
go,
nice
big
new
guy.
basket to go home in.
It's like a space shuttle. Good job.
Take care now.
Come on then.
Let's
Up
go.
we get.
Up we
Well
go,
done,
Taylor.
sweetheart. Look after yourself. Take
You'll
care.
take Heather.
Take care, Heather. Bye-bye for now.
If
Bye-bye.
you go...
Reunited with Heather, Siam will now have to adjust to life on 3 legs. In the kennels, Rosco has spent the last 3 days recovering from his hip replacement surgery.
Now, Roscoe's folks, please.
Jenna and Layla have driven down from Newcastle to take him home.
Good morning. How are you?
Good
How are you?
morning.
Nice to see you. Now then, everything is fine. So this is what we started with, which is a head that slips in and out of the socket, okay? And this is what we end up with, which is a head that's within the socket. I'm happy that this is as good as I can do with a total hip replacement on this side. Of course, we don't know what's going to happen with the other side, but at the moment, we're going to suck it and see.
Yeah.
Okay? Do you have any questions about that?
No.
So let's get him in. If you just push your chairs back. Good boy. There we go. There we go. There we go,
I wasn't
mate.
leaving you
There we
permanently.
go. Now, let's go out to reception.
Come on then, son.
What you'll see is that he's knuckling the foot a little bit when he walks. That's very normal at this point, and that should relax down over the next few days.
It's a huge relief knowing that everything's gone to plan and obviously everything's looking good.
We can encourage him to take weight on there by simply lifting the other leg.
Right. It's going to be very hard keeping him resting. He doesn't do resting very well,
Now let's just pop him in.
but he's going to have to learn how to, especially if it's going to get him better. So, thank you so much.
My pleasure.
Thank you.
All right, mate. See you in a couple of weeks. All right, look after yourself.
Thanks
Take
so
care.
much.
All right, you're very welcome. Take care, guys. Bye-bye.
Bye.
I think that's a sculpture of some sort.
In London, Apple, the bull terrier puppy, is halfway through her recovery.
Good girl.
She's finished her cage rest and is now allowed out for walks on a lead.
Apple is getting back to how she was before. She's just wanting to now be let off a lead. That would be her ideal. But we've got, I think, about 4 weeks to go until she'll be signed off, and all of us can't wait for that.
Good girl. She's definitely improved since we got her back on the after the operation. I feel like she definitely has more energy and she's happier. She's a good girl.
I think she was starting to get a bit annoyed that she couldn't go out, but she had the energy to go out, and I'm pleased for her.
I know she will probably have some arthritis, but I'm really hoping that her pain levels will go away and that she can have a far fuller life.
Apple,
this way, darling.
Come on, Apple.
It's been 2 months since Siam, the Siamese cat, was hit by a van and had to have his leg amputated.
After the stitches came out, we brought him out and he just amazed us all. Did you manage him with his 3 legs?
Yeah.
What did you do with them?
Jump over fences.
And the fences are about 8 foot and he scales up them, doesn't he?
Yeah.
What else can he do? What does he do with the neighbours' cats?
Fights with other cats. He scratches them.
There's nothing that I've come across that he cannot do now that he did before. He's just the same.
He's great.
Absolutely amazing, awesome.
He's back being himself.
In Newcastle, Rosco, the rescue dog, is finally back on duty at Jenna's side.
Everyone here loves him and he's a part of the shelter, so all of the staff worry about him. Everyone misses him when he's not around, so he was a massive miss, like any of the dogs would be. Go on then. The minute we saw him run, that was still a little bit anxious. We were worried that something would break, and now it's just amazing to see. Hello, mate!
We couldn't believe how quickly Rosco recovered from his operation. To see him in such a short space of time, running around, being so active, playing, and with a big smile on his face, he's back to being happy Rosco again.
He's going to be able to visit the kids he normally visits in the schools and the care homes who have been asking after him, so it's going to be so lovely for them to be able to see him again and to see how happy he is as well.
I think if you could see Noel again, you'd give him a big cuddle and a kiss and just say thank you so much, because it's transformed his life.
Rosco, come here. It's gone from being such a stressful time to an absolutely amazing time, and every little bit of stress, anxiety and any worry that was caused, everything's been worth it.
Good boy. Good boy.